Hello, everyone. My name is Aaliyah Wong. I'm an education enterprise reporter at USA Today. I will be the moderator for today's discussion about the nation's surge in RSV, the flu, as well as COVID reinfection rates, of course. Doctors are calling it a triple-demic. Some call it a tridemic, whatever you want to call it. It's getting a lot of attention these days, and of course has a lot of implications for our beat. We have so much to cover and limited time, so we're going to really try to focus the conversation on how the trends are affecting students and staff, and then how you as reporters can really maximize your reporting and advance the conversation forward. And without further ado, let me introduce today's panelists. They are in alphabetical order. First, we have Evie Blod. She's a staff writer at Education Week. Next, we have Dr. Danielle Dooley, a pediatrician and the medical director at Children's National Hospital. Next, we have Mark Lieberman, a reporter also at Education Week. And next, Dr. Allison Messina, chief of the Infectious Disease Division at Johns Hopkins All Children's Hospital. We'll start the conversation with some context just to sort of set the scene. You know, in many ways, it feels like the pandemic is a thing of the past, that no one's really wearing masks anymore. It's kind of kept to minimum. No one really does social distancing. But as we know, COVID is still very much here. Long COVID continues to debilitate what are potentially tens of millions of Americans. The flu season this year is shaping up to be the worst in a decade, and RSV also the worst in a long time. What this means is more absences, disruptions, temporary closures, a heavy reliance on substitutes. It may feel a lot of like deja vu in a way. And we know this is a super high stakes time academically. This is sort of the year of recovery, the year of accelerating learning. And what makes me worried, at least, is that the academic consequences of all these disruptions could be magnified this year. So I'll start off with our medical experts to help us set the scene. Maybe, one or both of you can help us understand this confluence of trends that we're seeing and why they're happening.
Sure, Dr. Messina, do you want to start?
Oh, you go ahead, I can chime in.
All right, well, I'm a primary care pediatrician, so I can sort of share what we're seeing, and then Dr. Messina, as the infectious disease expert, can jump in with her expertise. But, I think the big challenge right now is that, for the past few years, all of the measures that were in place to prevent the spread of COVID and infectious disease meant that children, were not around other kids as much, weren't around other people as much. So we just didn't have as many viruses circulating. We had flu season that was essentially non-existent the last 2 years. And now that a lot of those mitigation measures are no longer in place and kids are thankfully back in school and having contact with each other and other people, all of the regular childhood viruses like RSV and flu and rhinovirus are circulating again. And that's why we're seeing increased numbers of these, certainly in primary care. I think the other thing that makes it a little different is typically RSV peaks much later, sort of December to February. And in our hospital and practices in Washington, D.C., we really saw it peaking in October. So it was a much earlier surge than we're used to. Our most recent data shows that RSV and flu are now declining a little bit. We had a slight uptick in our number of cases of COVID. And I also want to emphasize that most of the flu that's been circulating that we've seen is influenza A, and this year's flu vaccine seems to have pretty good coverage for the flu strains circulating. So let me turn it over to Dr. Messina.
Yeah, that's absolutely correct. I think that one of the reasons I'll particularly use flu as an example, because that was, flu is a virus that we are used to seeing every year. And in the midst of the COVID pandemic in 2020, 2021, we had what was sort of an unprecedented, non-existent flu season. But if you really think about how flu spreads, flu is a global pandemic, it's a global phenomenon every year. And I think one of the biggest things, besides masking and social distancing, I think one of the biggest things that thwarted the global spread of flu was the shutdown of our transportation. You couldn't fly anywhere. You couldn't get an international flight from, the southern hemisphere to the northern hemisphere, et cetera. And so with that severe kind of crackdown on global travel, you really didn't see flu at all. And now without those safeguards in place, and I'm not saying that I want to shut down travel again, don't hear me say that, but I think with those, restrictions sort of ended, we're going to expect to see flu like we did before. And so I think that's a good example of, some of the disruption of other viruses that were kind of a consequence of all of the measures that we were taking. I think RSV is really interesting in that, the pandemic really sort of disrupted our normal RSV season. It's not unusual to see RSV, especially in the late fall and in the winter is when a more typical RSV season starts. And in the past, before we, before the media paid a lot of attention to RSV surges, we've had bad RSV years in the past. I know, I'm thinking back to when I did my residency many years ago in Texas, and I remember having RSV so bad that we had kids in halls and kids in tents outside in the ER. And so RSV can get quite bad. I think that maybe some of the reason that we're seeing this is we haven't had kids all together, like in school, in daycares, et cetera, and now all of a sudden after 2 years, we're kind of entering back into that, sort of more typical pattern. And now we've had a couple of years where people haven't had these diseases, so they may in fact be more susceptible to them, et cetera. But I think the one other piece of this that I want to bring up, and this is mainly most acute with folks like myself who mostly do inpatient medicine, is that the other part of this triple threat or triple pandemic or tridemic or whatever they're calling it, is also, especially on the inpatient side, it's a staffing issue. So when you hear that hospitals are overrun, when you hear that hospitals are, having to, turn away, scheduled surgeries and things like that, a lot of it also has to do with the fact that we're suffering like a lot of other, employers, and getting staff, healthy enough to work, getting staff that wants to work, that aren't burnt out from 2 years of this. And so, I think that my hospital is probably like many others in that we're having sort of a staffing crisis as well. And you add that on top of RSV, flu, and COVID, and unprecedented numbers of children, needing hospital beds. And then that sort of adds fuel to the fire. I know that's not sort of an education related issue, but I think it sort of is if we want to talk about the pediatric population as a whole, and we're stressed and we're hurting right now, I think because of all of these things.
Yeah, I would argue that's absolutely relevant to our coverage and something we need to take into consideration. From your vantage points, as pediatricians and medical professionals, what preventative measures are schools taking or not taking these days to protect students and staff?
Well, I think it's probably school by school, but I will say, so I live in Florida, and Florida was one of the states that very early wanted to get kids back into school and wanted to get them back in the classroom. And for a lot of reasons, that's a great thing. We all know that kids really do need to be in the classroom to learn optimally and to get that socialization. And so we did that very early. we also, we did away with our mask requirement, I think earlier than a lot of other places. And so there's a lot of those protective measures that used to be in place that really aren't anymore. And so that does allow respiratory viruses to spread. I mean, they are going to do that. I think some of the things that may have persisted a little bit, and which is good to see, is that I think people have a general little bit more of a heightened sense about maybe we shouldn't be going to school when we're feeling sick. Like that's something that I think that in the past, although I think everybody knew it wasn't a good idea to come to work or to come to school when you're feeling sick, I think people these days are a little more respectful of their classmates and of their colleagues. And, let's say when you have a cold, saying, hey, you know what, I'm going to just sit this one out for a day or so because I don't want to make you sick, kind of thing. And I think parents are doing that a little bit more as well, because they don't, I think that everybody understands that, wow, I don't really want to be sitting next to someone who has a cold, even if it's not COVID. I just don't really want to be sitting next to somebody who's coughing and sneezing all over myself, and so I think that there's a little bit more of a sense of community responsibility than there was before. And I think that, without sort of mandating things and making people do things that they maybe don't want to do, I would hope at least, and I think that I'm seeing a little bit more, community effort to keep each other healthy, which is nice to see.
I would just add to that a couple of things. I think there's also really increased focus on, some of the basic, really important tools we have that I know Dr. Messina's talked about before, but both hand washing and then, really frequently cleaning and disinfecting surfaces in classrooms, I think remains critical. And then I think another thing I would just share is, as an example, our hospital, with funding from United Health Foundation and our health department, was able to this summer have 8 Saturday mobile unit events at different schools across the city, where we were able to provide all of the routine childhood immunizations in addition to COVID and flu vaccines for families who needed them. So I think it's important to, really recognize those partnerships between schools and health systems where the care is brought directly to the community, because an important preventive tool that we have is vaccines for both flu, COVID, and then all of the routine childhood illnesses. Certainly in DC, our vaccination rates, for example, for under 5-year-olds really decreased dramatically during the pandemic. So finding ways to partner with schools where kids and families are in their community and bring vaccinations directly to them is another really important preventive measure that communities, I think, across the country are doing.
One last table setting question before we get into sort of the reporters' perspectives and some of the reporting strategies is, and maybe Dr. Dooley can chime in on this, or Dr. Messina. What do we know about kids in long COVID? What are we seeing?
I can start, and then Dr. Messina, do you want to jump in?
Sure.
So certainly from the primary care perspective, some of what I've seen is kids who have had underlying medical conditions, for example, a seizure disorder or a history of migraine headaches, who then have had COVID once, twice. Many kids have had it more than once now and have really experienced a worsening of their underlying medical condition, even though they are, essentially recovered from COVID and no longer considered contagious. That's one thing I've seen. I've also seen an increase in the number of patients with type 2 diabetes and type 1 diabetes, which we think it may be related to COVID infection. So those are some of the things I'm seeing in primary care. And at Children's, we do have funding from the National Institutes of Health to conduct a longitudinal study. We have several thousand kids enrolled who had COVID, and we are following them long-term because there is still a lot that we don't know. And what is the interaction between COVID and current or future medical conditions? So these are kids that are being followed for 3 years, and looking through multidisciplinary clinics at every single organ system, so heart, kidneys, as well as their mental health and mental well-being. So I think we are still learning a lot about long COVID. And I just wanted to share what I'm seeing in primary care, and then I'm going to turn it over to the infectious disease expert.
Yeah, thank you. I think that long COVID is a really interesting phenomenon to study and a very difficult one to study because there's, depending on who you ask, there's inconsistent definitions about what long COVID even is. So if we want to say, so I like to call it, especially in the patients that, that we're seeing maybe in our outpatient clinic, there's sort of complications of COVID that I think that Dr. Dooley was kind of alluding to. And we've seen similar phenomenon of kids with underlying medical conditions that are sort of made worsen by their COVID infection. We've seen kids with, clotting problems. We know that COVID causes, problems with blood clots and things like that we're seeing in our kids that have recovered from COVID. It's probably when we talk about sort of the long COVID type, brain fog and fatigue and things like that a lot of the adult patients are experiencing. I think we're seeing that slightly less in kids. Although I say that with a little bit of hesitation, because remember, our youngest kids have a difficult time sometimes describing those symptoms. If a 5-year-old has brain fog, they're probably not going to describe it as that. It will probably manifest in another way. So I think that when we're seeing the more, the kind of post COVID fatigue syndromes and the brain fog and things like that, we are mostly seeing it, at least in my clinical experience, in our older patients. But I always take into consideration, is it that they are older and they can describe it better? So it's really kind of difficult to know, exactly what, especially in children, exactly what their rates of sort of this long COVID type condition is. And so I think that there is a lot to learn, and I'm glad that centers like Children's National is doing longitudinal studies on this, because I think over the years we're going to learn a lot more.
Wonderful. Thanks so much, doctors. Let's turn it over to the reporters. Evie, I know you've been doing a lot of reporting on just how this tridemic and these infectious diseases are really affecting sort of day-to-day life in schools, particularly on attendance and just other disruptions. So tell me a little bit about some of your recent reporting and what people on the ground have been telling you about the effects on the classroom experience.
Yeah, I think when we report on schools and health, there are kind of two threads. One of them is what schools can do to contribute to the health of a community, which we saw a really big emphasis on that during COVID because of emergency laws, because they were working with health departments and governors. They had a lot more power to say, you must wear a mask, you must get tested, you must do XYZ, not only for the health of their students and for the functioning of the school, but for the role they play in the greater community. And that's where we saw a lot of disagreement as communication fractured, as the pandemic wore on. We had different levels of, or different perceptions of risk in different communities. So that's one way. What do schools do to contribute to the health of their communities? The other way is, how does the health of communities affect schools? And I would say that we're seeing that a lot more now. You could argue that some of these illnesses, I think the last I saw from the CDC was that 14 children have died of the flu this season. These illnesses are really affecting children. RSV is pretty awful thing to see a young kid struggle with. Schools have less authority now to do some of the things they did during COVID, even if they wanted to, which a lot of them probably wouldn't because of the divisive environment that we're in. So I think during COVID, we all got really focused on this idea of what authority schools have and are they using it properly? And now we're at this other end that's like it or not, this is affecting our operations, right? We've seen a particularly large cluster in Kentucky of schools that were just forced to close. And they can't always tell you that it's this particular illness that is causing us to close. It's COVID or flu or RSV. It's just so many kids are calling out sick, and so many teachers are calling out sick. So I think we've gotten into this mindset the last couple of years where people want to slice and dice whether a school should be closed or not. But these school leaders are telling me, we just don't have a choice. Like, this isn't really a question of philosophical issues. This is just the reality we're in now. And so I think student absences is a big threat, and staff absences is the other one that I would look at if I were a local reporter.
Speaking of staff absences, Mark, you've done some really amazing and just, heartbreaking reporting really on sort of the impact, in particular of long COVID on school staff. And that's such an underreported story. And, I was just going through some of your coverage just before this and just was reminded of how big of a story it is, yet underreported again. So tell us about some of your reporting, what you've been hearing from staff who've been affected by long COVID or just other, some of the other trends that are happening and sort of the layered stressors that this has caused.
Sure. Yeah. Well, thank you for your kind words. I appreciate it. Yeah, I've spent much of the year talking to educators around the country, teachers, as well as other people who work in classrooms, as well as some administrators too, who have been dealing with long COVID. Our survey data from earlier this year suggests that as many as 1 in 5 educators may be struggling with long COVID or may have at some point during the pandemic. And I think that the challenge for individual people who are dealing with this is that they're often not surrounded by tons and tons of other people who are also dealing with the exact same thing. And so many of the people that I've talked to who have long COVID have talked about, in addition to whatever physical symptoms they're experiencing for a long period of time, whether it's chest pain, breathing issues, heart damage, loss of taste and smell, whatever it may be, sometimes a combination of many of those things. There's also kind of a psychological weight that they have to take on because it's hard for them to convey to other people what they're going through. I've definitely heard from some people who said, to the outside world, I look normal, and so people don't understand why, at 2 p.m. I'm completely drained and I can't work the rest of the day, or people don't believe me when I say I have these ongoing symptoms, or doctors are reluctant to designate my illness as long COVID because they don't know a lot about it, or because they don't have the ability to sort of discern the difference between long COVID and something else. And so I think it's really, been a valuable learning experience for me to see both the variation in experience that people who have long COVID have. Everybody that I've talked to has had a completely different story in terms of which symptoms they have, how intense their symptoms are, how long they've lasted, whether they wax and wane or whether they're just consistent the entire time. And also even whether they go away. I've talked to some people recently who said, there's one teacher I talked to who was around my age in her 20s, and she said that she early on in her long COVID experience couldn't stand up for more than 15 minutes straight in her classroom. And she actually had to leave the classroom at the end of most recent school year. But since then, she's dramatically improved, and she's kind of back to, if not normal, then pretty close to it. And so there are some hopeful things to be taken away from this too. But anyway, the kind of the variety of experiences, and then the sort of isolation that people who are dealing with this feel. And just as an anecdote, when I wrote this story, I've gotten a bunch of emails throughout the year, more than I've gotten for almost any other story I've ever written on any topic, from educators saying, I have long COVID too, and I thought I was the only one, or it's so refreshing to hear that other people are experiencing the same thing as me, or and I think that really reinforces the importance of finding people who are struggling in these ways. Tell their stories with compassion and as well as detail, just to kind of help people understand what people are going through.
I'm curious how, I'm sure now that your coverage is out there and more people are noticing it and they reach out to you, but initially, how were you finding some of your sources?
Yeah, it's a great question. It was sort of a mix. There was one person who was sort of one of the earliest people to identify herself as someone who had long COVID, the very early stages of the pandemic. And she had testified in front of Congress, and she had sort of made a bit of a public name for herself in advocating for people with her condition. She's a teacher in Baltimore County in Maryland. And so I talked to her. In some cases, I just asked other sources that other people I talked to for other stories, and asked them if they knew anyone who was dealing with this. And then, like I said, we also did a survey where our colleagues at Education Week and the Research Center conducted a nationally representative survey. And like I said, we had tons of respondents there indicating that they had dealt with this or knew someone who had. And so that was a fruitful avenue too. In one or two cases, one of the people I talked to said, "Oh, I know this other colleague who is dealing with this other thing that's completely different from me, but is classified under the umbrella of long COVID too." So, it was a mixture of just kind of tapping into those connections, and then also kind of just realizing that many of these people, despite the kind of personal nature of sharing these intimate details about your health and your job situation and your emotions, many of these people were very, very eager to talk and to have someone listen, kind of no matter who it was, which I think kind of reinforces the responsibility that as reporters we have to kind of treat these stories with the care that they deserve.
Evie, what have you heard as far as the academic impact of these disruptions, the absences, the teacher absences, the lack of subs, and do we know yet as to what the equity implications of these absences are?
First, I just want to give a little plug for the idea that the Department of Ed released guidance on long COVID in students, just if that's interesting to anyone, and said that if a child has long COVID, they may be entitled to civil rights protections under Section 504. Of course, you've got the question of, has someone identified it as long COVID? Do the parents know to ask for those accommodations? But if a child needs, remote learning for a time or whatever. Academic effects are a really hard thing to tackle, right? We still don't know the academic effects or we can argue about the academic effects precisely of the school shutdowns in 2020. So do we have day-by-day data that says because of all these absences in September, these kids are doing better or worse? Not at any kind of scale. Now their teachers might be able to say, even just in terms of volume of coursework done. One big effect is, going back to 2015, there's been a higher emphasis on chronic absenteeism in schools. And that's because the Every Student Succeeds Act said every state could pick some sort of other indicator, non-academic indicator to measure how their schools are doing and identify schools that need help. And a whole lot of states picked chronic absenteeism. So that's how many kids miss either 15 days a year or more than 10%. And we've seen those numbers just skyrocket during the pandemic, even in states where, closures weren't that big of a deal. I saw that Nebraska had a surge in chronic absenteeism, which kind of counters the narrative that that's just because of closures. So a lot of schools are really trying to regain ground there to try to build the habits, to try to fight against attendance related anxiety, that school refusal, which has become a big problem. And it's really just kind of hard to build that momentum when you have these constant interruptions from things like illness. That is coming at a time when schools are trying to do all of these acceleration things. You might not be able to measure the downstream immediate effects on academic achievement, but you could ask questions about participation rates in tutoring. You could ask questions about numbers of subs that schools are having to bring in. You could also pay really close attention to student groups that are often overlooked. For example, students with disabilities many of them were at higher risk for COVID. Many of them were among the families that fought to keep universal mask mandates in school. Well, now we've got other respiratory illnesses that can affect these children. Are they masking? Are they asking for remote learning? Are they concerned about falling even farther behind when many said schools didn't meet their needs to begin with? And then the other group I might look out for is English language learners. And the reason I would say that is because when schools are short on teachers, when they're short on subs, they oftentimes reshuffle the deck and try to put just an adult body in a classroom. And oftentimes teachers who teach special populations get pulled into general education classrooms. We hear that from special ed advocates, and I hear it a lot from teachers I know who teach English language learners in pull-out situations. They're getting pulled away from the students they're supposed to work with to be the warm body in the classroom. And how is that affecting continuity for these kids who need extra support? So those are some of the things I would look at.
That provides a perfect segue to my next question, which I'll pose to all our panelists. Now that we're, for better or worse, very experienced at covering, public health through an education lens, and can start to think about how to improve our reporting, what perspectives or voices would you like to hear more from in our coverage or see more in our coverage? And anyone can start off.
I have to say, I've actually learned a lot about this, the school impact and learning impact actually from talking to the children themselves. It's really interesting to, I think as grown-ups, as doctors and teachers and such, we like to talk about how things look from our lens, but I've had some really interesting conversations with my patients, with my own children, with their friends. And it's very interesting to hear from their perspective how school closures and pandemic and what are the kids talking about, what are they talking about it amongst themselves, what were the challenges. So I think that's maybe a population that we should explore their voices a little bit more.
I think parents of color, always overlooked in a lot of cases, parents of students with disabilities. And then I would also say support staff. I've heard from a lot of districts that one of the reasons they've struggled with bus drivers is that their bus drivers used to drive in from an affordable community 40 minutes away. Cost of living is higher. Is it worth doing that when for a part-time job, when it costs me more to get there, and when my health is potentially at risk? Populations like semi-retired folks, parents who are working multiple jobs, the kind of jobs that keep schools going. I think people are always interested because the whole concept of a labor shortage can be really flattened out. But why are individual people deciding to make these choices, and how is that having downstream effects?
I would just add to build a little bit too on what Mr. Lieberman was saying. I think the pandemic has not been the same for every child and every family. And as much as it's important that we look for some trends. I think, the work you've done to lift up, you and Ms. Blatt have done to really lift up some individual stories is important, because it is really critical that people may relate to something that they have read about what another student or family is struggling with. So I do think highlighting some of those individual stories whenever possible is really important, because it has been such a unique experience for different families. And then I think the other thing, I definitely agree with Ms. Blad about all of the different roles in a school that it takes to make a school operate and run. It is really critical that, you know, we listen to those voices as well. And then finally, I guess I would be interested to hear more from philanthropy and what they are doing, recognizing that this is just a really, in some ways, I think the most critical time for children in the pandemic, because it is, you know, they are depending on us to help them figure out how to manage some recovery from the past few years, and not only recover, but then thrive. And so I think it is going to take, you know, greater both philanthropic, federal, state, and local funding investments than ever before to really ensure that students, families, and schools have the resources they need to succeed.
And then I'll just wrap up very quickly by adding, echoing what everyone else said, and just adding that, you know, I think there are people, whether we're talking about students, parents, school staff members, administrators, for whom the pandemic is very much an ongoing lived reality, not something that can in any way be construed as being in the past. You know, I talked to a teacher recently who had long COVID. It's sort of gone away, but she's very concerned about the possibility of getting COVID again, because if she does, her long COVID symptoms may come back. You know, I talked to people who have long COVID who also have family members who have long COVID. Obviously, we know tons of people have lost people close to them to the virus, and continue to do so every day in America. Thankfully, not at the same rate as early on in the pandemic, but still at a you know, to an extent that is of major concern. So I just think it's important to kind of emphasize that the public consciousness of the pandemic may have changed, but the lived experience for many people has not.
Thanks so much for all those tips. Super, super helpful. Let's open it up to the audience for Q&A. I'll kick it off to Asia to help facilitate that. You're muted, Asia.
Sorry about that. Feel free to ask any questions at the bottom. The Q&A tab is towards the bottom of the screen. Right now, we have a question from Angela Garter. She asks, is there a trend right now regarding kids further falling behind academically? With so many kids out sick due to COVID, flu, colds, or RSV, and still trying to catch up academically post-COVID, how can parents combat this learning loss at home?
So there's a couple things I would suggest from the health side, and then welcome the education colleagues to weigh in. But I think, you know, a few things that parents can think about are, again, using the tools that we have. So for prevention of illness, like hand washing, you know, minimizing contact with others who may be sick, or if they're sick, vaccinations for flu and COVID-19 or other important ways to prevent further learning loss. I think also it's important that when your child is feeling better, and most often the guidance is, you know, 24 hours fever-free without fever-reducing medicine and an improvement in symptoms, unless, of course, you're in COVID isolation, you know, really returning to school then is important, and not staying out for a prolonged period of time. And it's important that our school districts have reasonable policies around return to school, so that kids who've had a cold can get back into school when they are feeling better. And then I think the other thing is really whatever we can do to support children and families with their mental health. This is an important time to visit your pediatrician or your school counselor or a community-based organization that may have mental health services for your student or your family if you've identified that there may be some mental health issues contributing to, you know, issues with attendance. I think that should be on all of our radar, and really helping families to get access to those services.
One thing you could ask schools is, a lot of schools developed habits to keep children engaged during isolation in the earlier part of the pandemic. Are they using those now for any other form of illness? Educators would tell you that attendance and engagement are really about dozens of little choices that children make and that they make within a system every day. And so attendance is about keeping families engaged in not just the question of, do I come to school when I'm sick or when I have a headache, but also just like, all of these things that are a little harder to define, like school refusal, like anxiety and things like that. So I would ask, what is your communication with families like when children are ill, and has that changed at all because of the pandemic? And also, how has your attendance strategy and your work with families in that area changed? Have you changed your messaging? Are you using early indicators to flag students sooner to help recognize family needs? Are you doing anything different with how you work with homeless students who might have chronic absenteeism and identifying their needs?
Has everyone had a chance to answer the question? I can ask the next one. We're good? Okay. So this one is from Jack Wood. What actions can principals take to effectively respond to this tridemic?
I think I'd kind of like to loop back to what Dr. Dooley was saying. I think that we do have tools to help protect students especially from flu and from COVID. They can be vaccinated, and we know that historically vaccination against influenza in school children has been very low. And my understanding is that this year, coming out of the first couple of years of the COVID pandemic, flu vaccination rates amongst children are really down. And I think that it's almost kind of fallen off of people's radar that there is this vaccine available, and that especially this year, it's a pretty good match for what we're seeing now. So I would encourage, even if it is not one of those vaccines that is mandated for school, I would certainly encourage it. That'll help tremendously keeping some of these kids in the class if they've not had their COVID vaccine, to encourage that as well. And then it's things like all of those things that we learned about preventing respiratory illnesses during the pandemic. They still work for things like flu and RSV. Social distancing still works, when you're sick, trying to keep distance from people, hand washing or hand sanitizing, using, the whatever alcohol-based hand sanitizers are actually really convenient for schools. Kids can take them with them to clean their hands before they eat, after they eat, etc. And then cough etiquette, things like covering your cough, covering your sneezes, and then, disinfecting surfaces and things like that really do, I think, go a long way to not only prevent COVID from being spread, but all of the respiratory illnesses, or many of them are spread similarly. So I think that, paying attention to those things is really helpful. And I think it's also important to remember too, that when I talk to people, sometimes they say, well, I did that and I got a cold anyway. But I think saying that even if we can prevent some, even if we're not preventing every single case, if you can prevent 50% or 70% of the time somebody getting sick over a population of your entire school or a population of your entire city, that's actually quite a few people. Even if you say you have a 50% reduction in spread of X illness, that's tremendous. And it's I think that a lot of people, when they hear if it's not 100%, they say, it's not worth doing. But actually, when you're talking about populations, that's not the right way to look at it. You can prevent a lot of illness, even if percentage-wise you're not protecting against 100% of transmission.
Thank you so much, Dr. Messina. Anybody else want to take a stab at answering how principals can effectively respond to this tridemic? If not, I'm gonna go on to the next question. Holly Hexter asks, what are the implications of lower vaccination rates for common childhood diseases? Is there a problem nationwide, and what campaigns are underway outside the DC area?
Well, I can say that, that's something that we're really quite worried about, because vaccinations for all childhood illnesses did drop off a lot during the COVID pandemic, mostly for access reasons when, early on in the pandemic, pediatricians' offices were closed sometimes for all but emergencies. So when we start to see, so we talk a lot about herd immunity, right? I mean, when we talk about, how many people in a population are immune to a certain disease, and that really impacts how far and wide that disease can spread in a population. So when we have kids who, used to be, kids as a population, when they used to be 95%, let's say, vaccinated against measles, even those 5% maybe of children that were not vaccinated against measles would enjoy the protection of the herd that is vaccinated. When that starts to drop, then everybody who isn't vaccinated, or everyone who can't be vaccinated, or everyone for whom let's say the vaccine didn't work quite as well as it should have, that puts all of those people at risk when they are not protected by the immunity of the population. So as we start to see, measles vaccination rates go down, we will see measles outbreaks. When you used to, and you're already seeing that in certain populations. New York had its first case of polio recently, and it was, again, it was associated with a community for whom the population vaccination rate was poor, and that's where you start to see these, these diseases that we don't really think about very much anymore. They can come back. And it is a little bit distressing to hear, my kid doesn't need to be vaccinated for, let's say, chickenpox, because we haven't seen that lately. Well, it doesn't mean it's gone. And all it takes is that herd immunity to wane. And then you will start seeing these things again that, we don't really see very much anymore. And I know that a lot of the, pediatricians I talk to are concerned about this, not just because of the implications of seeing those diseases, but these are diseases that a lot of pediatricians have never seen. My residents, for example, have never seen a case of chickenpox. And, it takes the old people like myself to, to even recognize when a kid comes in with these types of symptoms. And so I think it's really concerning that childhood vaccines in general, may be decreasing, because I think that will mean that we have a lot of work to do in surveillance and keeping our eyes and ears on these things, and really understanding that when they come back, what are we going to do about them?
Dr.
One,
Dooley.
oh, I'm sorry. Go ahead, Dr. Dooley. I'm sorry.
No, I think Dr. Messina covered it. Go ahead, Ms. Blad.
Yeah, I was just going to say a story idea for folks is that, first of all, we're seeing measles cases in Ohio too, which is, we've seen surges of them in communities with low immunization rates. And every state has a different law that some states allow different kinds of exemptions, religious, medical, and then there are these broad philosophical exemptions, which allow families to exempt themselves from school-based vaccine requirements. And a lot of times they don't have to explain why. It's a pretty wide open thing. And before COVID, there's a pretty big effort to change state laws like that. And some states, including Colorado, amended or attempted to amend their requirements. California, a few others. And those efforts flew into all of the discussion of vaccines during the pandemic. So, I'll be honest, I'm not sure if any states ended up changing their vaccination laws in response to concerns that COVID vaccines would be mandated for children, but that was discussed. And, some of the same states that have very high vaccination rates for other illnesses, suddenly we're seeing state lawmakers say, let's get rid of all mandates just because of the noise over the COVID vaccine. So you could look at your state's law on exemptions for vaccines compared to other states and talk to, organizations that have advocated for that to change. There's also data, I think it's county level from the CDC about vaccination rates compared to other areas. So you could see if your community is relatively more at risk. And that's a good question to ask.
Okay, we're running a little low on time, so I want to leave with this last question for Evie and Mark, our journalists. What pitfalls would you like to warn reporters about if they want to cover this?
I'll just say it's more of a question of should schools be open or closed, and that turned into the only question anyone knew how to talk about for the last couple of years. And so I would caution against reactivating that. Is every decision my school made correct? To be sure that that doesn't drown out the conversations we're having now. But I think Mark will have more to say.
Thanks, Evie. Yeah, I would just add, certainly for telling some of these personal stories, but even really for some of the great work Evie's done on kind of untangling these policy changes and kind of confusion around those. I think prioritizing as a reporter your mental health is really key. It's not easy to do, but it is something that's important to think about, I think. These interviews that I've done with people who are dealing with long COVID can be quite emotional. I've had a few people, tear up on the phone. Sometimes these conversations go for 45 minutes, an hour, or even more. We're talking about pretty challenging circumstances that people are in, sometimes fairly graphic details of health issues. And, that can take a toll, especially when the kind of takeaway from the conversation is, the subject of the interview is struggling and doesn't really know how they're going to get help. So, there's no easy way. I don't think I have a magic solution to kind of maintaining your mental health in the face of reporting on some of these difficult subjects. But I would say what's helped me, at least, is kind of keeping in mind the end goal of doing this reporting, which is to inform, to kind of elevate people's voices that aren't being heard. The feedback that I've gotten, like I said, from my long COVID coverage, is like a good illustration of that. It's very rewarding to hear that your reporting is making a difference for people who are looking for information. And even if you don't get that feedback right away or even at all, I think kind of focusing on the value of the task that you're doing in approaching some of these difficult subjects has been the biggest help for me. It won't work for everybody, but I think the biggest thing is just remembering that this stuff is hard and it's okay to feel like it's hard, and give yourself the space to feel that. So.
Thank you so much, Mark and Evie. I would like to thank our guests, Evie, Mark, Dr. Danielle, and Dr. Allison. I also want to thank Aaliyah for moderating this great conversation we had today. And finally, I want to thank you guys, all the attendees and the EWA members who took time out of their days to join us. As soon as this webinar closes, an evaluation survey link will be emailed to all the participants. Please complete it. Your feedback is really important to us, and we really want to improve. And finally, visit EWA/events to sign up for more upcoming online in-person seminars. And I also want to highly encourage the journalists to apply for EWA Awards program. The deadline is January 9th, 2023. So you can find more information at ewa.org/EWA Awards. And thanks everyone, and have a great day. Bye everyone.
Thank you.
Thanks.